name is Heather Ercolano, and I'm a second-year orthodontic resident at the Stony Brook School of Dental Medicine in the Advanced Education Program in Orthodontics and Dental Facial Orthopedics. My present research focuses on measuring the effects of orthopedic maxillary expansion and soft tissue changes. This investigation is using a special three-dimensional camera system and its associated software developed in the Computer Science Department at Stony Brook University. The aim of this study is to attempt to quantify 3D facial soft tissue changes due to orthopedic maxillary expansion depending on the amount of expansion. The specific sites of interest are the middle and lower facial regions. The study sample is orthodontic patients aged 8 to 16 from the clinic at Stony Brook with transverse discrepancies requiring orthopedic maxillary expansion. The patients were scanned with the 3D camera system prior to the initiation of rapid palatal expansion and after the expansion period was complete. Once the images were acquired and processed, 13 soft tissue landmarks were selected and a statistical analysis will be run using the geodesic and Euclidean lengths. In addition, heat maps are being generated to evaluate the surface changes. The results from the study will help clinicians in orthodontic treatment planning for patients requiring orthopedic maxillary expansion. This will aid in evaluating the predicted changes that can be expected depending on the magnitude of the expansion that was planned for the patient. This data will be a guide for orthodontists to be able to fully understand the impact maxillary expansion has on facial aesthetics, specifically the soft tissue changes. The foundation funding is essential for supporting the research and development of the technology needed for the three-dimensional camera. The camera and associated software for assessing soft tissue changes that occur will be important for orthodontics as we transition into the 3D world of diagnosis and treatment planning. The computer algorithms developed in this research will add an important part to the puzzle of how soft tissue is affected by orthopedic changes in the skeletal structures.